Good morning, people. I have a disclaimer. Not so much of a disclaimer, but an introduction of who I am and why I am qualified to speak on different subjects and give my brutal, honest truth. I am checking, I am researching, I am talking to the people, I'm going off of my experience, and I cannot stress enough that there is a problem in our community, and the problem is mental illness. Let's talk about it. Let's put this on the table. Mental illness is real in the Black community. You don't believe it? Look at your neighbor. Look at the people that you work with. Look at your children. Look at the people that you live with. Look at yourself. Look at the news. Turn on the radio and tell me that mental illness is not prevalent in our community. We choose to ignore the signs and the symptoms of mental illness. There are levels to these conditions. When we hear people say they OCD, I just have to have everything so clean. Oh, don't touch this and don't touch that. And you got to hurry up and go sanitize and clean. Huh? I'm a germophobic. You have germs and bacteria in and on your body. Nothing, and I'm not attacking them. You have people who are ADHD. My oldest son, he is sensitive to light. Cut that light out. Turn that light out. Especially when he's not feeling well. Okay? I have another son who don't want you to ask him any questions. He gets frustrated. So there are several conditions. You have autism, where people can't sit still. Well, some are underdeveloped, where they may be 13-year old but can play and get along with a 5-year old and not people their own age or around their age. You have people that cannot think rationally or control their impulses. I am talking to the adults and young folks, but I'm talking to the adults because I'm coming down my street now, who may get depressed because the money isn't flowing, the bills are coming in, and the job is laying off, and the jobs are cutting, and the job is on your behind, and your relationship and your marriage isn't going the way you expected to. Maybe some people have let you down. Maybe you're having frequent run ins with authority. Maybe you're not in the best neighborhood. Maybe your house or your apartment is falling apart. The children are becoming overwhelming, and groceries are not coming in like you want them to, or you can't vacation like you want to, or your car is breaking down every payday. And then your cigarette habit has increased. You're smoking more, you're drinking more. Now you experimenting. Now you experimenting with drugs. Now you putting this on your cigarette, and you're putting this on your weed, and you putting this in your cup. I know. And they call it depression, anxiety. These are real life issues. And these are real feelings. And then when the kids see that the parents are stressing, and then it put a strain on the children. Now they feel like they have to help mom and dad or their caregiver. Now they out here selling, willing and dealing and stealing because they don't like how mom and dad or their caregiver is feeling. Now they're taking on the role of responsibility. Again, I'm not here to bash anyone. I'm not here to make anyone feel bad. I'm not calling nobody out by name. I'm just saying that we have a crisis in our community, in our homes, and we need a solution. And I'm going to start with this, and I don't mean no harm. Some of us is on welfare. There is a hotline number on the back of your insurance card for mental health, for behavior health. Use that number. Some of you have primary care providers. Make an appointment and express your cares and your concern for yourself, for your children, and whoever else is under your health care plan. If you do not have a medical card, there is the Board of Health. There is some kind of free clinic that will assist you and getting care for yourself and the ones that you care for. If a free clinic does not work, take them to the emergency room, express your care and your concern, and the social worker or the intaker can give you information on where you can get help, free and or assistance, and referrals. Get evaluated. For those who do not know, at your child's schools, no matter what the level, there are nurses, psychologists, and social workers available at your children's school. Now I'm going to go down my street. My two oldest boys, they had a speech impairment. They stuttered. I used to stutter, and we'll get caught up every now and then. The school that they were going to noticed it was a issue, and before class, I would have to take them to another location where they had a class, speech therapy. I didn't ask for help. The school picked up on it. Like myself, they get caught up every now and then, but for the most part, they no longer stutter. Not like they used to. So, getting back on course, the school, reach out to the school. They are there to help. You would be surprised of studies, testings, free, okay? And some that will, charge a little or nothing, that will help you. This stuff is no longer cute because that's what we thought when they would throw stuff and use profanity and lash out and do all kinds of um, unpleasant things, and it's, oh, they'll grow out of it. Oh, I'ma just whoop they behind, they'll be all right. I'ma just put them on punishment and time out. I'm gonna take away this and take away the phone and take away that and take away the game, and now they're going upside your head or someone else's head. These kids and young adults is going far as unliving people in their homes, their mothers, their siblings, their grandmothers, their fathers, their neighbors, their educators. You have some kids and adults where you can visibly look at them and tell they're not wrapped too tight. There's an issue, there's a shortcoming. Do not wait until they become adults, when you no longer have authority to get them kids help. You know pretty much when they come out the womb, because if you get the proper prenatal care, they will let you know before the baby is born that they may have some issues. Stop ignoring. Stop ignoring the signs and the symptoms of mental illness. I've seen a video. I couldn't tell if this was a little girl or a little boy going at it with his mother, calling her the B word, blocking her from getting past, screaming at his mother. I've seen another video where a little boy kicked a grandmother in the lower part of her abdomen. And it appeared that he done it twice. And whoever is around, they're recording. Now, you may be recording for evidence, but who called the authority? Who went and got help for these babies? And these were Black kids. That boy that unlived that 23-year-old girl, allegedly, people are coming out making videos saying that he was weird. The way he was looking in windows and going around the house, that was weird. It was reported, not my words, public information, that he stole a car that day. I'm not looking at the young man. The parents. And if this young man has some kind of psychosis or behavior problem, I'm not diagnosing him. I'm not diagnosing him at all. The parents had to know something. Or the parents could be a little off. I don't know. All I'm saying, people, is to recognize the signs and symptoms, get help for your peoples. There's no time to be ashamed. It's not a time to care about who knows we on medication, who knows we coming in and out of mental health. I'd rather for someone to know that I'm on medication and going in and out of the mental health department than to suffer humiliation that I or my loved one is incarcerated because they didn't hurt someone or themselves, or someone has to plan a home going because we could not control ourselves mentally and or physically. That's embarrassing because you could have done something about it. There are institutions. I worked at a facility with patients that had mental illnesses, whether it was dementia, Alzheimer's, or schizophrenia. And to see them go from one extreme to the next, as in mood and behavior, watching them being combative verbally and physically, watching them chain smoke cigarettes, hearing voices, talking to someone that I can't visibly see, eating their own feces. It's real. And some of them are sexually abusive. It's real. If our children is out here in these gangs, in these organizations and cliques, and could pick up a gun and go out in these streets and kick people doors in and pull people out their cars and go to schools and go to the nightclubs, the grocery stores, the church, on the corner, in the corner store, out a car, in a car, and commit murders and crimes and shootings, is that not a form of mental illness? I'm not at liberty to diagnose anyone and then come back home like they haven't done nothing. I've seen videos and documentary where young black men say they go to bed with murder on their mind. They wake up with murder on their minds. I've seen documentary and videos on YouTube where young men talk about going to bed with rape on their mind. Who they gonna get? How many they're gonna get? This is real, and these are somebody babies. They didn't just wake up like this. And if you want to say that drugs and alcohol turned them that way, again, I'm not a professional in that department, but I believe the drugs and the drinks just enhance what was already in them, or gave them courage to carry out their plan. I had bariatric surgery and everything be gurgling and moving around in there, so I apologize. But again, if you need to talk, I'm available. You need some help, you need some assistance, I'm available. There's an email, You can message down below. I'm here for my people. Always have been for the betterment of my people since I was about 5 years old. Always helped my people. And that has not changed. Why? Because there's been times where I've needed help mentally, physically, emotionally, financially, spiritually. If I didn't already mention that, I needed help in all areas of my life. And I went out here in these streets to the hospitals, to the clinics, to my educators, to my neighbors. I even went to churches and establishments crying, pleading, and begging for help. Okay? So I know, and I may can help someone with resources, with educating, listening, without my opinion, without my judgment, without going around telling any and everybody your business. That's not necessary, and that's not going to help. Until next time, love yourself, take care of yourself, and be kind to yourself.